everybody, my name is Dr. Justine Blaney from the Justine Blaney Wellness Center, and today we're going to talk about disc injuries. And oh my gosh, they hurt so much. When you have a disc injury, it hurts so much to cough, to sneeze, to contract, to lift. You might end up with shooting pain like sciatica down your leg or shooting pain down your arm. That's when it's acute. But sometimes a disc injury is building up slowly over time. That degeneration is happening in the disc, which is the shock absorber between the vertebra and your spine. And it might lead to things like weakness in your hands, or numbness and tingling in your hands, or sensations down your legs. Now, when these numbness, tingling, or shooting sensations might happen, they can happen in different patterns. For example, it could split up in your hand with the radial nerve, the median nerve, or the ulnar nerve. Or down your leg, it might be shooting sciatica down the back of your leg, or it might be numbness and tingling in your big toe from the L5 area, or it might be more of an L2-3 into the groin, L3 into the knee, or L4, as we say, to the floor, coming down to the front of the leg. So we have different nerve patterns that we're going to follow when we look at the shock absorbers in the discs. And I just want to let you know, the nerves control everything in your body. Between each vertebra, though, we have shock absorbers called discs, and they can degenerate, they can herniate, they can bulge. Now, the best way to see a disc or disc damage is with an MRI. Second is with a CT scan. And then third with an X-ray. An X-ray lets us know, it sees the bones, but then we can see if the space is getting smaller between the two bones, indicating that there's degenerative disc or thinning of the disc happening at that area. When we look at those nerves in your neck, they're the ones that can affect into things like headaches, moods, depression, numbness and tingling in your arms, or even when you look at the nerves in your neck following the vagus nerve, it might even affect things like your blood pressure, your breathing rate, your thyroid. I've herniated the nerves in my neck, and that led to numbness and tingling in my hands to the extent that I could barely hold a cup or my tea. When I herniated the disc in my mid-back here, that affected cramping on the stomach. And when we've worked with other patients with disc injuries in the lower back, that might more affect down your legs. So when we look at a normal disc, you will see a normal disc would have a thick shock absorber and bones that look like straight lines. The nerves are nice and thick with a big hole for the nerves. If you have degenerative joint and disc, the disc is now thinner, much smaller size. It gets compressed. And the hole for the nerve is much smaller as well. So then you have that term which people talk about as a pinch nerve, compression on that nerve. And so you'll see that at times you can get a disc herniation. That means that the disc starts to leak out and you get a bulge on that nerve. You can also get things like stenosis. That means that the actual hole where the spinal cord, central stenosis, that hole goes from big to small. Or that's canal stenosis or central stenosis, or on the side you can get lateral stenosis, where again where the nerve exits, the hole gets smaller. So our goal, of course, is always to find these problems sooner rather than later, before it starts to progress. And that's why we do numerous orthopedic tests. We might raise your leg for a straight leg. We might do a Braggart's test or a Bowstring's test or Jurgen's test, Eli's test. There's numerous different tests for us to, those ones are for your lower back, to test for nerve damage. With your neck, we might do a Jackson's, a compression, a Sperling's test, a Valsalva, again looking for nerve damage or disc damage. In our office, we also use computerized nerve scans, and the red area is looking for areas of inflammation. So this is a scan of somebody, this is mine, after I hit my head, where you can see inflammation of your neck and your lower back. So in our office, we try to have the highest level of technology to look for areas of disc damage or nerve damage in areas of subluxation. After that, once we've done a thorough examination and what we call a report of findings, we create an action steps for you. We do have specific techniques and adjustments designed for lower back and neck if you have disc damage. This is not when you have rotation. There's no rotations. There's often no snapping, cracking, nothing like that. It's a much more gentle technique that is customized to you. I hope this helped with lots of questions about disc damage. One of the things that I want to remind you, if you have disc damage, we want to avoid flexing forward, especially flexing forward with rotation, like getting your laundry out of the machine or getting something out of the dishwasher. So we want to avoid those skills and also limit the amount of sitting. Sitting is the new smoking. Though when you sit, that compresses the discs in your lower back. And for your neck, we want to avoid flexion. So that's like on your phone or on your laptop or computer. That damages the discs in your neck. If you have any questions, we'd love to help. Contact us at the Justine Blaney Wellness Center. We offer complimentary consultations to help you best. We have a lot of information about the Mackenzie exercise program on our website, which is designed for your lower back disc injuries. Please feel free to see those videos. We have a strengthening video for your lower back and stretching video for your lower back and for your neck. Take care, and I look forward to seeing you for the next talk.